very good morning, ladies and gentlemen. We are about to shortly begin in another 10 minutes, requesting everyone to kindly assemble in the main hall, please. Thank you. Ladies and gentlemen, please do not forget to sign the Patient Safety Declaration digitally. Kindly collect your lunch coupons from the registration desk if you haven't still done it. Please get more information on our Patient Safety Club and enroll today for the latest updates and happenings in the field of patient safety and quality. Do spare time to see the e-posters. Visit Quality Stall to know more about our quality systems and processes. You can download the International Health Dialogue app to know the latest happenings of the conference and activities. Your certificates will be digitally on your app. Please take selfies at the selfie booth. Please give feedback for the conference on the app and participate in the lucky draw and win exciting prizes. Yes, sir. Namaste and very good morning to all present here. Distinguished guests, speakers, senior dignitaries, faculty, and dear members of the Apollo family. On behalf of Apollo Hospitals Group, I once again extend a very warm welcome to you all for the Day 2 of the 8th International Patient Safety Conference and 9th Transforming Healthcare with IT Conference 2019. Healthcare has been evolving and transforming at a very fast pace. We are constantly finding newer and innovative ways of solving problems. With many dynamic methods, approaches, and initiatives available, breakthrough initiatives are constant in healthcare. On that note, I would like to take this opportunity to invite on the dais Dr. P.V. Murthy, Executive Vice President and Global Head, Human Resources, Taj Group of Hotels. Dr. Murthy is qualified in law, advanced human resources, executive coaching, and psychoanalytical aspects related to leadership and change. He is an alumni of INSEAD and has a PhD in strategic human resource management. He currently serves as the Executive Vice President and Global Head Human Resources at Indian Hotels Company Limited, the finest hospitality chain and the oldest company in the prestigious Tata Group. Ladies and gentlemen, please put your hands together for Dr. Murthy.
Thank you. Thank you. Thank you, ladies and gentlemen, and good morning to all. My name is P.V. Ramnamurthy, and I thank you for that kind introduction. And I want to thank Apollo Hospitals for this invitation, for having me here as a speaker. So I represent a company called Indian Hotels. Indian Hotels Company Limited is the name of our company. And we have 175 hotels across the globe. In 4 continents, we have 175 plus hotels. And we operate brands like Taj, Vivanta, Selections, Ginger, TajSats, and others. I'm aware of the fact that healthcare is fundamentally different from hospitality. And what I'm going to present here is 2 of our initiatives, 2 of our transformational initiatives. They are transformational in nature, and I would be briefly touching upon those initiatives. Many of you would be aware of the terrorist attack in 2088 in one of our flagship hotels in Mumbai. What stood out during that particular attack, the terrorist, the unfortunate event, was the kind of care our employees provided to the guests. It was not just taking care of the guests, it's not just about ensuring safety of the guests, it's also about providing service excellence during that particular time. When we went around speaking with our employees who were there in the hotel during that particular time to understand as to what made them do whatever they did, what actually came out was very, very surprising. That's where I'm going to touch upon that particular aspect which came from our values and culture. And I'm going to talk about the values and culture and how we build and sustain our values, the great culture we have inherited from our forefathers. The second initiative I'm going to talk about is around process excellence. How do we make sure that we have the right kind of processes, and how do we ensure that our employees are trained on these processes? While I said that hospitality is different from healthcare, I see several similarities, especially when it comes to the culture, the values, and then the process excellence, I see several similarities. So when we look at the presentation, when we actually, I'm sorry. Yes. Yeah, it's okay. Yes. So I was speaking about the service excellence which was shown by our employees. It was not just during one crisis moment. Okay, thank you. How would I go back, sir? I'm so sorry. Just one second. I want to go back. Oh, yes. My apologies. My sincere apologies. So I was speaking about the service excellence, which consists of safety as well. Since this conference is around patient safety, I would be touching upon the service excellence at our hotels, which involves the safety. And I was talking about the service excellence and safety of our guests, which was shown by our employees during that particular terrorist attack. What came out was the values and culture of the organization. Many of you would be aware of what our founder, Jamsetji Tata, said 150 years back. He said something like, community is not just another stakeholder, it is the very purpose of business existence. And when we interviewed and when we talked to our employees who were present during that time, what came out was, it's all about others. It's about giving to the customers who have been providing business to us. It's about serving the customer even in the most difficult time. And then I want to touch upon the Aspiration 2022, which is basically our strategy. Every business would have a strategy. And when it comes to our group, Taj Group of Hotels, Indian Hotels, Aspiration 2022 is our strategy. If you look at it, Aspiration 2022 fundamentally aims to achieve iconic status and also wants to become most profitable in Southeast Asia. While that's the aspiration by 2022, if you look at the building blocks, the values of trust, awareness, and joy, it's TAJ stands for trust, awareness, and joy, is what we communicate within the organization. And also, the Tata values of integrity, excellence, unity, responsibility, and pioneering. Those are the values. And as I move to the next slides, I would be speaking a little bit more about the values and culture, like I said earlier. And the enablers, when you look at various enablers which we have identified, we have realized that culture and high customer engagement are the differentiators for our business. While we have called them as enablers, this is fundamentally what differentiates us from rest of the other organizations, is what we believe. And the initiatives of restructuring, reimagining, and reengineering, I'm not going to go into the details of those initiatives, but what I'm trying to say here is that any organization built on a pyramid, on the foundations of values, would be very, very strong. I was speaking about the purpose. the purpose which our Jamshedji Tata spoke about when he talked about the community and serving the community is the very purpose of our business. So you would notice that, it is profit and purpose. They have equal weightage, or the profit earning is for the purpose of giving back to the community. Moving ahead, the first initiative I would like to touch upon is the culture building. How do we build culture within the organization? We believe that culture is the shadow of leaders. And we also believe that culture flows from the top. Given that scenario, there are a few initiatives within the organization. And what is mentioned over there as the first one, humility, humanity, humor, and hope. That's our leadership framework. I was chatting up with Professor Sibal just before this session, and it was a very interesting conversation. And I could see several similarities between both the industries, healthcare as well as hospitality, in terms of building humility among the leaders. So this is where we have designed long-term programs for building that 4H model, the humility, humanity, humor, and hope among our leaders. And also, what we do is we get our leaders together once every 3 months. All the leaders would congregate at one place. And what we do is we impart emotional intelligence and mindfulness to the leaders. You would be aware of the fact that when it comes to serving the customer or the patient, it's more about the emotional intelligence, as to how do we understand our own emotions and how do we understand the emotions of the other person and how do we manage the situation is what we teach to our leaders. And also the mindfulness. Mindfulness is all about being present in the moment. And I believe that it's more important for the healthcare industry when it comes to mindfulness. And similarly for us also, we believe that mindfulness is an important thing. And this is where we have designed programs around emotional intelligence and mindfulness, and we train up our leaders on these aspects. And also when it comes to leaders, what precedes before these programs is a lot of assessments. We use a lot of assessment tools like Hogan, Emotional Intelligence, EQI 2.0, and also various feedback mechanisms, be it 360 feedback or 720 feedback. And we give that feedback and design programs basis the feedback which we receive. And then finally, the leadership code. The leadership code for the organization talks as to what needs to be done, what can be done, and what cannot be done. The fundamental purpose of leadership code is to bring trust, awareness, and joy to life. And while I'm speaking about the leaders as the carriers of culture within the organization, what we have done is at various levels within the organization, we have created these programs around the values or the values of trust, awareness, and joy. And even for the frontline employees also, we have app-based emotional intelligence and mindfulness sessions. And then the second initiative I would like to touch upon is the process excellence. While we could put our focus on culture and values, when it comes to the actual delivery, what's very important is the process excellence. This is where at our organization, what we have done is we have looked at all codified and uncodified processes. The processes related to safety, operations, whether it is food and beverage, or it is front office, or it is housekeeping. We have taken all the processes from all the 175 hotels. Some processes were codified and some processes were not codified. We have collected all these processes and created cross-functional teams. And this was one of the biggest initiatives we have taken in the recent past, creating cross-functional teams and ensuring that they are simplified and streamlined and communicated to all the employees within the organization is what we have done. One important element which we took into account while structuring or codifying these processes is looking at the philosophy. While process steps are important, when there is a conflict between process steps and philosophy, why we have a particular process, so it is important for our employees to look at the philosophy and take decisions. It is not that we can become bureaucratic in the name of processes, or following the processes is what we meant. And what we have done is, after codifying all these processes, we have created a platform, a digital platform, and made these processes accessible to all the employees. Now, what we call as Ignite, IHCL Global Network for Information Training and Excellence, all the processes, all the codified processes are available to all the employees in all the hotels, in all the continents. They can access these processes. And also, the objective is to train up our employees on each and every process. And also, I was speaking about the cross-functional team. How did we do that? The process excellence, driving the process excellence. So fundamentally, it's a cross-functional team. Many of you would be aware of the fact that MIT has done a lot of work around the process excellence or creating cross-functional teams, and I think they called it as X teams. We followed the same model. And what we did was we reached out to the frontline associates and then understood as to what is the implication of having a particular process or a particular process step. This was for the purpose of simplifying the process steps. And once we did that, what we did was, we had lots and lots of stand-up meetings. Many of the leaders reviewed these processes every week by looking at the work which is being done. And it was a 10-minute stand-up meeting, which was taken up. And also embracing technology, I talked about Ignite platform and enrolling specialists. There are several specialists within the group, whether it is food and beverage or kitchen or a chef. Taking inputs from them and aligning all the stakeholders is what we did. If you look at the strategy, Aspiration 2022, which I was talking about, and the connect between the process excellence, fundamentally you realize that by doing this, we could reduce the cost. Many of the unwanted processes have been eliminated, and we could improve the people productivity, and also the service excellence has gone up. That's where it supports the business strategy of Aspiration 2022. And finally, we believe that it's a matter of excellence. And when it comes to excellence, J.R.D. Tata, he said something like, one must forever strive for excellence. And we believe that it's all about culture and excellence. And what's very interesting is that probably great minds think alike. When I was looking at the internet to find out as to how Apollo Hospitals works, what I find there is something very, very similar what Dr. Pratap Reddy said about excellence. I thought that, great minds think alike, and finally, whatever we do would result in better culture and values of the organization and creating process excellence. Thank you very much. Thanks once again for giving me this opportunity, and I hope there is some value add to this session. Thank you.
Thank you, Dr. Murthy.
I would now like to invite Dr. Indu Bhushan, CEO, PMJ, and National Health Authority to share his thoughts. Dr. Bhushan serves as the Chief Executive Officer of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and the National Health Authority, Government of India. Dr. Bhushan is an ex-Indian Administrative Service Officer of the Indian Civil Services 1983. He holds a doctorate in Health Economics and Masters of Health Sciences from Johns Hopkins University, USA, and as an alumnus of the prestigious Indian Institute of Technologies, Banaras Hindu University, and IIT Delhi, where he completed his education. He will speak on power of scale. Ladies and gentlemen, please put your hands together for Dr. Indu Bhushan.
Good morning, everyone. And thank you very much for inviting me here. And I was asked to speak on power of scale. And as some of you may know, I work for this scheme called Pradhan Mantri Jan Arogya Yojana, which was put in place about a year ago by Prime Minister Modi. When he announced this scheme from the rampart of the Red Fort, he famously said that this scheme is going to cover a population which is larger than Mexico, US, and Canada put together. Of course, in terms of numbers, it's a mammoth scheme and going to be benefiting large number of people. And if we can implement it well, it's going to be reaching more than 500 million people. And the purpose of the scheme is that no one should be impoverished or go below poverty line because of expenditure on health. So this supports people for secondary and tertiary care and for inpatient care. And in times to come, it will reduce the out-of-pocket expenditure in a big way. So it has a huge potential for changing the health sector, but at the same time, I want to share with you that because of the scale of the scheme, it will do much more than what was intended to do. And I'll share with you 10 things that this scheme is going to do beyond the stated objectives of the scheme. The first thing that it has provided already, that it has provided a framework for all the states to rally around. When a big scheme comes and when a big player comes, all small players come together. That is exactly what has happened with the scheme, both at the national level and state level. At national level, there were several small schemes for health insurance. Some were for weavers, for fisher folks, and many others, ministries had smaller schemes. All those schemes will now merge with this Pradhan Mantri Jan Arogya Yojana. We are going to be covering about 540 million people, but if we include everyone else, probably now we are going to be covering about 650 million people because of this. Even at the state level, states are finding this scheme as a fulcrum around which different schemes are going to be merged. And for example, in Karnataka, there used to be 7 schemes, and now they are merging it together on the back of PMJ and making one scheme. Similarly, in Kerala, there used to be 3 schemes, and PMJ is incentivizing them to come together and make it into one scheme. And when we have this kind of convergence or merger, that helps in terms of reducing administrative cost, but also it helps in terms of implementation of those schemes, because confusion both on the demand side and supply side reduces. So that is the first thing this scheme is going to do because of its scale. Second thing that the scheme is going to do is provide ecosystem or develop ecosystem for health insurance or health assurance. As you can understand that in our country, the reach and depth of health insurance is limited. Only about 10 to 15% people are covered through health insurance before the scheme came in. Now, with this scheme, we are sensitizing people, consumers, hospitals, and also creating an ecosystem for health insurance. We have worked with IRDA, which is based in Hyderabad, your own city, where we are developing standards. We are working on how to impanel hospitals across all different schemes and how to create an IT platform for claim management. So all this has been possible because of the scale of the scheme, and the scale of the scheme will help strengthen the ecosystem for health insurance. Third thing, which is related thing, is that because of necessity of this large scheme, we had to create an IT backbone. And I'll be talking about that later as well. But this IT backbone is important and useful for our scheme, but also will help other schemes to for this. So we have created this platform for implementing the scheme PMJ, but the same platform is being used by many other states for implementing their own scheme. So it's going beyond, the benefit is going beyond the implementation in PMJ. Fourth thing that this scheme is going to do is bring down the cost in the entire health system. And I'm saying that because when we are covering the health care for 500 million people, we have the power of collective bargaining. Right now, when a person goes for seeking health care, that person is negotiating prices on his or her own. And in many cases, because of his bargaining power is actually low because of asymmetric information. Now, with the collective bargaining, we can bring down prices. We can also bring down prices of not only services, but also devices, implants, and all other inputs that go into services. So that is possible only because we are dealing with large number of people, and that can help bring down prices not only for our scheme, but also for the health sector in general. Fifth thing this scheme is going to do, because of its size, is correct the many distortions that we have in the health sector right now. If we look at the health sector, currently there are large inequities in terms of rural-urban, in terms of rich and poor, and if we look at distribution of hospitals, doctors, 70% of the larger institutions are in urban areas. Now, with this scheme, when we have more than 300 million people living in rural areas, it's creating a huge demand. And that demand is going to help in terms of expanding supply, and both through public sector and private sector, and help in changing the distortion, bringing in more supply, more private sector in Tier 2 and Tier 3 cities, and thereby improving the equity of the distribution of public and private facilities. Sixth thing this is going to do is help in improving quality of services. And I say that because now, in a large way, we are giving the power to choose where to go to the customer. Earlier, these people didn't have any choice. They had to go where the prices were low or it was free services. Now they have the choice. They can go to public sector, they can go to private sector, and within private sector they can choose where to go. Now they are going to be voting with their feet, and by doing that, they will be choosing the best quality. At the same time, since we are dealing with 500 million people, we can also enforce quality standards. We are working on standard treatment protocols for all the packages that we support, and we have that ability to enforce those standard treatment protocols. That will help in terms of improving quality, both from the supply side, but also from demand side. And seventh thing that this big scheme is going to do is collect a large amount of data. And you would ask that how would the large amount of data help in terms of improving anything for the health sector? This data helps us in terms of providing analysis on what is happening, what is the pattern of disease, and provides a lot of policy information about what kind of policy should be put in place for improving services. So again, this data being collected through this scheme is going to help not only the scheme in terms of more effective monitoring and evaluation, but also support the health sector in general. Eighth thing that the scheme is going to do is improve efficiency in the sector. And I'm saying that because right now, currently, the model in most of the hospitals being followed is based on approach which is large, high margin and low volume. But since we are providing high volume, the whole model and approach is going to change to low margin because we are going to be setting rates and high volume. And that will be possible only if efficiencies are increased, the costs are reduced, and quality is maintained. So we hope that the whole health sector will be benefited by this scheme through improvement of efficiency. Second last point I want to make is that the scheme is going to promote innovations, because this is going to provide a fertile ground for various innovations to come in, because provision of services to more than 500 million people is not easy. Monitoring of those services and ensuring that services are of good quality is also not easy. So all that will require large amount of innovations, both in IT spheres, but beyond that. So this scheme is going to spur large amount of innovations, we believe. And finally, because of the size of the scheme, what we see is that this scheme is gaining a lot of attention, both at the social level, but also at political level. And the reason probably you have invited me here to speak is because I'm heading this scheme which is so large. Similarly, there is a large amount of social scrutiny of the scheme because of the size of the scheme. This helps us keeping on our toes and improves accountability of the scheme. But at the same time, since it's going to be helping more than 40% of population in the country, there's also a lot of political support for the scheme. And that helps in terms of putting health, I think for the first time, at the core of development agenda, political discourse in the country. So, and that also is possible only because of the size of the scheme. And all this potential that I've told you that the scheme has for changing not only the lives of these 500 million people, but also changing the health sector will be possible if we implement this scheme well. And I know that we can implement the scheme well only if we work together with all of you, together with large number of stakeholders. And I am thankful that to Apollo for inviting me here and sharing my thoughts here. And I want to close with the African saying, which says that if you have to go a short distance, you can go alone. But if you are going a long distance, you have to go in groups. And for going the long distance, obviously you need different kind of skills, and it has to be a collective action. And I hope that all of you, we can make this scheme a success. Thank you very much.
Thank you, sir.
Welcome to International Health Dialogue 2019, a fusion of patient safety and IT in healthcare at the 8th International Patient Safety Conference and 9th Transforming Healthcare with Information Technology. Healthcare has a poor safety record compared to other industries. 1 in 10 patients are likely to be harmed while in the hospital. 20 to 40% of all health spending is wasted due to poor quality care. As healthcare providers, it's our most important responsibility to do justice to our profession, to give the patients the quality care they require. For the past 9 years, through these twin conferences, we have been continuously thriving to share our learnings with each other, to further improve the quality of healthcare. During these 2 days, we will be covering topics on imagining a perfect world, leveraging innovation to revolutionize the healthcare sector, and building the best workforce to fill the needs of future healthcare. We'll be talking about healthcare safety and fueling the future of diagnostics with Lab 2.0, the leadership mantras to drive new age strategies, and thinking the media effect on what patients want. Unlocking the potential of healthcare and IT to improve patient safety measures in small format hospital facilities. we will be experiencing the powerful mind of global leaders with their interactive sessions. An insightful session on the modernization of healthcare with Thinking Big, incisive workshops on basic life support. How AI can and is boosting the prospects of healthcare, and to bring forth standardized policies to digital healthcare in India. Across 38 breakout sessions, 200 plus speakers, 5 joint plenary sessions, practical theme-based sessions. Experience innovative exhibition and display, and join us for International Patient Safety Awards and Chime THIT Awards. Let us pledge ourselves for patient safety, deploying and adopting the right technology in the right context to get the right outcomes. We welcome all 2,000 plus delegates from 30 different countries. Let's innovate, inspire, imagine.
Having quality healthcare is an absolute necessity. With a well-developed healthcare system, citizens of a nation are able to prevent and be treated for diseases, illnesses, and physical injury. Without a good healthcare system, people will be unable to afford or receive the treatment they need, which results in poor quality of life. A dialogue between nations to better understand each other's healthcare systems can prove to help us find better solutions. On that note, may I now invite Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Enterprise Limited, Ms. Paula Wilson, President, Joint Commission International, Dr. Indu Bhushan, Chief Executive Officer and CEO Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, and the National Health Authority, Government of India, and Dr. Harish Nadkarni, Chief Executive Officer, NABH. Ladies and gentlemen, please put your hands together. Morning. I would now request Dr. Sangeeta to kindly step forward and take the session, please.
Good morning, ladies and gentlemen, and namaste. Gives me great pleasure to welcome all of you for the second day of this exciting and it's beyond a conference, so I'm not going to say, invite you for the conference. It's truly an exchange of ideas. It's a format in which we come together to discuss, to explore, to make some of our own plans of what are we going to do in our health institutions, what are we going to do in our IT areas, what are startups going to do, and how do we all come together. And in case our senior members on stage are wondering, how can you exchange and interact in such a large audience? So the joint plenary, sir, are only 2 programs in the morning. Afterwards, we have almost 9 breakout sessions. So there's smaller groups, there are discussion forums, and there's a lot of exchange of ideas which is happening. So I'm extremely happy to welcome our senior dignitaries who are on stage. Ms. Paula Wilson, who's the president of the Joint Commission International, is very well known to people who frequently attend this conference. Paula has been a guide in Apollo's excellence journey, and I think she's been a guide to many, many other institutions. When she comes in wearing the Joint Commission hat, she's extremely strict and very, very distant. But when she comes in at the conference, she comes in sharing ideas, she comes in encouraging, she comes in inspiring each one of us to pursue our journey and to find ways to continue on the path, however difficult it is. So Paula, I not only welcome you to the conference, but truly thank you for everything that you have done for quality healthcare in India and the journey that it's taken across Asia as well. It is my great pleasure to welcome, even though all of you have already heard his outstanding lecture, Dr. Indu Bhushan. Dr. Bhushan, we are as excited as you about the tremendous responsibility which has been placed on your shoulders. For many years as healthcare providers, we felt the pain. We saw it personally up front that people would pawn their wives' jewelry or sell their land to pay for healthcare. And so for the last 30 years, actually, Apollo has waged a relentless war on finding a way to bring universal health coverage. Whether it was the small Apollo Health Association, a not-for-profit body, was launched by the then Minister Moshina Kidwai with the sole purpose of bringing inclusivity and universal health coverage. This then translated into Family Health Plan, which was the country's first TPA. We worked on schemes like the Argonda Health Insurance Scheme, the Arogya Bhadrata Scheme for the police force, the Yashashwini Scheme, which we ran for 9 years after we had put the original program together, and then went on to do health insurance. Because we strongly believe that high quality care cannot be the burden of a single family, but the responsibility of society at large. And today, having the government spearheading it on this scale makes us extremely happy, because we understand and appreciate the fact that soon, step by step, phase by phase, at a scale which is unimaginable anywhere else in the world, our country will be covered. We will be proactive. We will be extremely thoughtful about the way we deliver care. And in this, I want to share with you, sir, that when health insurance was first formed, and Dr. Rangachari was the first IRDA regulator at that time, Dr. Reddy wrote a letter to Dr. Rangachari dated 2020. And he said, in that letter, he said, "Dear Dr. Rangachari, I want to thank you for the foundation you laid for health insurance in this country, because what you have done, health insurance is now inclusive. People across the country have care. We have integrated alternate medicine with Ayurvedic medicine, and both are and allopathic medicine, and all are covered under insurance. You have included preventive and promotive healthcare so that people are screening, doing health checks, and this care is not only for the extremely sick, but you are being proactive about prevention, and that is part of the gamut of this. In India, health insurance is also in the life insurance category, because it is only people who think about life who will spend the money, and not people who are doing general insurance per member per month. And went on to elucidate a number of these thought processes which are policy and foundational towards building a health insurance. So today at the International Health Dialogues, where we combine patient safety, quality, and health technology, we're extremely happy to have you here, Dr. Indu Bhushan. And on behalf of the health sector, we definitely pledge our support to the tremendous initiative that the Prime Minister has announced, and you and a group of very enlightened people are driving in such a qualitative manner. Dr. Harish Nadkarni, the Chief Executive Officer of NABH, it is most appropriate that you are here, and we welcome you for the conference. NABH is the standards body for the country, and it is so important that all of us subscribe to the National Accreditation Body. I remember before the formation of body, and I'm seeing Doctor here, but a group of us went to Thailand and studied the model and shared some of our quality processes and put together some of the guidelines. And it's so nice to see how NABH has evolved, NABL has evolved, and across the country this is becoming a movement. So I think we're set for a tremendous program. I'm very, very happy that both these joint conferences are coming together year after year. And I welcome you to this because what you do when you take away a daily life in a hospital is hectic, it's full of patient, it has, sometimes crisis type situations, and the pressure of the day sometimes do not give you time to think and dream and plan. So when we come together to inspire each other, to commit to innovate, to meet with startups, and finally to imagine this new, healthier, beautiful world, I think it's a wonderful thing. And so let me once again welcome you and hand over to our tremendous speakers who will share with us their thoughts and help us on this journey of inspiring us towards a healthier, better, happy world. I want to just add one thing, that yesterday in our Imagine session, we spoke about the power of technology and science and innovation. And we said but one thing, that we're thinking that, we're moving pretty fast. But actually, if you look just 12 to 24 months from now, things are going to move much faster. You may have heard about 5G. At the back end of 5G is a movement which is happening to build the world's supercomputer. In hermetically sealed labs, they are building this supercomputer where the concept of IT today is binary, whereas the supercomputer thinks quantum. And actually biology is quantum. Our human body is quantum. It is these thoughts, so what you think of as fast today is going to look extremely slow. In very simple terms, what we download a movie, it takes a few minutes and we're very happy, we watch the movie on the plane. This download of a movie from Netflix is going to take under 2 seconds in the 5G. So if you've been moving really fast, get geared up to move much faster because the world is going at that pace. But if we move together, I think we'll do it for the common good of humanity and we will all be very fulfilled by the journey that we're taking. Thank you all very much and welcome.
May I now invite Ms. Paula Wilson to please come over and share her thoughts.
All right. Thank you. 15 to 20 minutes. So, a little different than what I was told first, but that's okay. I can do it. So, good morning, everyone. I'm very, very happy and very proud to be here. This is my 4th Apollo Patient Safety Conference, and it's always an exciting event, but I must say, Sangeeta, this is amazing. They've all been great, but this is at a scale and a depth that I haven't seen before, and everyone on the Apollo team should feel incredibly proud of the efforts that you obviously put into this and the great work that's going on and how much all of us are getting from this event. As mentioned, I'm the President and Chief Executive Officer of Joint Commission International, and we are an accrediting body based in the United States but working globally. In fact, we work in 71 countries today, and we have over 1,000 accredited organizations, and we actually are celebrating our 20th anniversary as an international accreditor of healthcare organizations. And we are very proud of that achievement. But I have been encouraging our staff to think about the next 20 years, and what are the opportunities and threats to an organization like ours that is committed to the quality and safety that patients received in accredited hospitals. And I'm extremely excited by what we're learning at this conference about the potential for digital interventions and tools and techniques to help improve patient safety and quality in organizations all around the world, whether accredited or not. So I am optimistic about what might be coming both to the healthcare industry as well as to the sector that deals with quality and safety for patients. At the Joint Commission right now at JCI, we're working on our 7th edition of standards that will come out next year, and we're focusing more on some of the patient safety issues that result from technology. It's certainly something that's very advantageous and helps organizations, but it also comes with some threats. So we're looking at ways that threats to safety have come from things like electronic health records and the use of cut and paste in a record. We're looking at the safety of devices, and we're particularly interested in devices that are connected to the internet and the cybersecurity of devices and machines that we use treating patients, and to making sure that they're safe and protecting the privacy of healthcare, of the patients, of the healthcare organizations. We're exploring what all of the digital interventions and innovations mean from an accrediting point of view. We're looking at this, is there a way for us to do our work better as a result of the digital technology opportunities? Can we do more using data? And I think we'll definitely be working in that arena to improve our impact in helping organizations more in terms of how to do better at patient safety. So as I was thinking about my comments for this morning and what's happening here in India and the work of the Indian Ministry of Health, NABH, colleagues certainly in safety and quality, and I have had the opportunity and pleasure of working in the healthcare industry for many years, including in the public sector in the United States. And the conversation taking place in India today reminds me to some extent of the conversations that we had in the 1990s as we started to try to attempt to get to full access in the United States, which eventually we did much better at when President Obama was able to pass what we call Obamacare. There's certainly been political back and forth maneuvering around that, and you see that today. But the conversation originally, one of the things I think that helps us understand how to understand the challenges of doing really good health care is to think about health reform as a three-legged stool. I think we all know what a three-legged stool is, and we understand that in order for a stool to stand, all three legs have to be strong. So if we think of the three legs as the quality of care, the cost of care, and access of care, the challenge for governments everywhere is to have all of those things working well at the same time. And I think where India is heading is giving you an opportunity to create a strong three-legged stool. In the United States, we have good quality health care. With Obamacare and other efforts, we have almost complete access, not perfect, but most of the people in the United States have access to health care with insurance. But it's come at a terrific cost. We've really not got the three legs resolved in the United States. We have good quality, we have good access, but currently we spend about 18% of our gross domestic product on healthcare costs, which is not sustainable. And if you were privileged to be here yesterday and listen to Dr. Reddy's comments, he has the same concern. As the population ages and chronic disease becomes a threat and a challenge for healthcare reformers. So I would advise, as the Indian government is thinking about how to proceed, to look at the United States as lessons learned, some positive, but also some that I would say you would avoid. We have a problem with cost. Our current system is not sustainable. We also have an aging population and an increasing chronic disease, and we're already at 18% of gross domestic product. So if we don't figure out how to do better on cost, this is not sustainable. And so we're looking at, certainly as a country, and we in the healthcare industry in general, as to how can health help? How can digital tools and technologies help us create the third leg of the stool so the stool will stand up and be strong? And I think there's great opportunity for that in several ways. One is that I believe that, and we've seen some demonstrations of this in this conference, is that technology is going to allow us to expand the spread and scope of an individual provider with things like telehealth and some of the other digital interventions. We don't have enough physicians in any country anywhere. So the access question will continue to be a challenge, but we see technology as an opportunity in that realm. On the cost side, I think that technology is definitely going to have an impact on helping us reduce costs. It's going to force some disruption that we haven't had to deal with in the past, and we'll get at the volume price issues that drive costs. From a quality perspective, the insights that we will be gaining from data, I think, are going to have enormous improvement opportunities for us in really helping us understand, why do we have sentinel events? Why is there harm? We know a lot about it, but getting to patterns and of behaviors and data insight as to why events happen in different types of organizations is going to help us do better as a quality and safety organization, and I think that will be true for accrediting and quality organizations around the world. So I think my summary would be that from a perspective of the accrediting organizations, we do see the technology as a great opportunity. We see a lot of challenges in all countries in terms of getting those three legs of the stool balanced at the same time. But what we're seeing in a conference like this are so many tools and opportunities to improve in all three realms: quality, cost, and access, that I can't help but be optimistic about our future in terms of everything that we're working on in healthcare. So I want to thank Sangeeta and the Reddy family for inviting me again to this wonderful conference, and I look forward to our morning dialogue. Thank you very much.
Ladies and gentlemen, please, we would like to now invite Dr. Indu Bhushan to share his thoughts.
Well, good morning again. To share with you that I belong to, of course, IAS, and I was working here, but for last previous about 25 years before I took up this job, I was out of India, so I was based in Manila. So when this job offer came to me, I would have sleepless nights thinking about how is this scheme going to work with 500 million people. How are we going to identify them? How are we going to ensure that they are the people that they claim to be? How are we going to get all the hospitals on board? And how are we going to link those hospitals with insurance companies and make payments and ensure that they are paid on time and there is no fraud? And of course, when we came here, I knew that there is a lot of talent and capacity within our country, and I'm glad to say that we could establish this very robust IT platform which has been able to connect these 500 million people with more than 18,000 hospitals and 32 states and UTs who have so far joined the scheme. And not only that, our IT platform is serving beyond these population in some cases and supporting other schemes as well. And our scheme has been the first one, I think, at least in the health sector, where from day one we have had a live dashboard, and we can see up-to-date information on who's taking treatment where, and what kind of claims have been raised, what has been paid, which are the highest, or which are the hospitals who are raising claims. So that has been very effective in terms of monitoring the scheme on almost daily basis. And the kind of data that we are collecting, and we've collected more than now 100 terabyte of data, also has been useful in terms of seeing if the scheme is going in the right direction, and we keep changing our design and many features based on the feedback that we get. And we are also starting to analyze this data, not for only health sector but beyond health sector, to see if in some cases we need to do more on maybe water sector, or maybe there is an issue with the environment in some cases, and a certain type of cases are coming from certain kind of geographies. So this has been actually great in terms of, but now we've also realized that we have to go to a next stage, and there are many other things happening in the country, and recently Ministry of Health has come out with the National Digital Health Blueprint, and in the next session Mr. Jason Narana will speak about it. So we have to look at the future, and we are now preparing what we call IT, PMJ IT 2.0 version, that how to take this to next level and ensure that our system is interoperable, scalable, and can adopt innovations in future and can use the best technology that is available now. And at the same time, we want to make sure that the system is secure and respects the privacy of our clients. So we are going to be working on that, and in that process, we'll be seeking support and help and coordination with many of you here. Second thing that we are doing, apart from improving our IT infrastructure or IT system, is working on fraud and abuse. And very soon we'll be finalizing our partner who can help us in terms of through big data analysis to support us in terms of identifying our potential fraud and abuse cases and providing us triggers that can be followed up. Finally, we are looking for support for improving the quality of services, improving efficiency of services, and reducing cost through innovation. And those innovations could be IT innovations, but also could be non-IT innovations. And end of this month, Honorable Prime Minister is going to be launching a grand challenge which will invite startups and others to work with us and identify solutions to some of the problems that we have in terms of expanding our reach, in terms of improving quality and reducing cost. And I'm hoping that some of you, if not many of you, will take up that grand challenge and work with us in identifying those solutions. I want to thank you again for giving me this platform and sharing with you my thoughts and inviting you to work with us for improving the health status of our country. Thank you very much.
Thank you, Dr. Bhushan. We would like to now invite Dr. Harsh Nadkarni to share his thoughts, please.
Morning. Thank you for inviting me here and discussing something about NABH. As Madam Reddy said, this national body was formed in 2005 with the cooperation of healthcare industry and which put in a lot of efforts to get it in place. And the initiatives also came from Ministry of Tourism as well as Ministry of Health. And in 2006, the first edition was launched, and we are now very close to launching the 5th edition, which will be in a week or so. What are the challenges that accreditation faces? Any one of them. Now, scaling up, it's a very important aspect in accreditation to scale up to the geographic scale of various things, to accommodate various types of healthcare units, accommodate to various types of practices that they follow, and still bring them to a uniform quality system, which will be such that it will be beneficial to all. There is always a balance when you develop standards between what is minimum and maximum. Minimum is too loose, maximum is too tight, and therefore one has to strike the balance in between. So every time you have to draw the line or raise the bar a couple of inches more to the point that organization can jump up and catch. If the bar is too high, they touch and fail. If the bar is too low, everybody hangs on to it and does not have any meaning. And therefore accreditation is required to produce a structure by which organizations can progress further with the help of those objective elements. One of the challenges in any accreditation is maintaining repeatability, reproducibility. You must understand that accreditation assessments are a measurement system. They are measuring quality. They are no different than measuring blood sugar or measuring anything else. There is always a risk of repeatability, reproducibility going down. Repeatability in the sense that same assessor faced with the same findings will give the same non-conformity, and will different assessors faced with the same finding will give the same non-conformity. Repeatability, reproducibility increase the validity of the system as well as brings comfort to the assessed organization that they will be fairly assessed. And this always is a challenge for any accreditation body, which NABH pays special attention to. It is also necessary that though we are looking at improving healthcare system of the country, individually the organization also should benefit in its efforts. And those benefits are always in any industry linked to cost versus efforts. And therefore this aspect also is required to be kept in mind when the standards are developed. Therefore those standards are not prescriptive in terms of implementability. The implementability aspect has to be looked into. What is organization supposed to do? Is it possible to be done? And is it cost beneficial to the organization while getting the maximum benefits? Another important aspect of any accreditation system is changing culture. There is a sentence attributed to Peter Drucker that culture is strategy for breakfast, lunch and dinner. Nothing can be more true than this. It is the culture that determines the way things are done in any organization, and therefore accreditation certainly should change the culture of the country through its hospitals and country's healthcare system. I think NABH has been reasonably successful in bringing patient safety and infection control into focus, and one of the greatest contributions are these. In fact, recently NABH did an external study with statistically validated sample size across the country to find out what are the perceptions as well as what is the impact. And we are very happy to note that the net promotional score with the top management for NABH was 77. While we always talk about clinicians not being participated in this process, whereas NPS from clinicians was 74, which is really heartening to any organization which carries these activities. What are the current scenarios? NABH has today assessed, certified, accredited or empaneled more than 7,000 organizations of various types. We carry out approximately 3,500 to 3,800 assessments a year. In other words, per week there are about 70 to 100 assessments going on anywhere in the country when NABH is performing its activities. NABH also supports various projects of government. Recently it carried out Niti Aayog project of data validation in district hospitals, where 709 district hospitals were assessed by NABH for this specific purpose within a matter of only 2 months. An astronomical task considering the geographic spread and the variation to reach there. What can accreditation do and what it cannot do? If you are expecting accreditation to bring perfection by just getting certified, it is not going to happen. And therefore, organization has to have a background quality system which conforms to the requirements of assessment but also has many activities. And therefore, in any accreditation system, it is accreditation body's aim and desire to provide that infrastructure on which these various quality projects will be accommodated without affecting their accreditation status. That means all the quality management related projects must go in synergy with the accreditation and its requirements. And we at NABH try to do that very consciously. And this is more or less that NABH stands today. For most of you may be aware that I am retiring on this month end, and I am very sure that NABH will go to greater heights, far greater heights in years to come. And that can only happen with all your support. Thank you very much.
Thank you, Dr. Nadkarni, and
I want to thank our panelists before I hand over the mic to Dr. Hari Prasad. The first thing that I'd like to say is, how are you all doing? Very well. Good? Okay. Have you all signed the Patient Safety Declaration? Have you seen the pledge? So that's the thing. Some of you have. Everybody please look at the Patient Safety Pledge. Make sure you carry it back to your hospitals. go through it. It involves everyone. That was my first kind of this thing. The second very, very important announcement I want to make is that September 17th is a very special day. Do all of you know why? Yes. So this has been declared by WHO as the Patient Safety Day. So within your hospitals, and that is the day that we will also collate all the learnings from the Patient Safety Conference and the IT conference integrated on patients, and these will be presented to senior leadership and governments across the country to show our solidarity and our commitment to patient care. And I also heard would like to think that it's a very special day in another way because it's also our Prime Minister Modi's birthday. So September 17th is becoming a double celebration of someone who is very, very committed to patient care, to bringing healthcare within the reach of everyone. So let me thank our wonderful panelists. We're going to add an interesting Q&A session now, so that we let the audience ask questions. To coordinate that Q&A, I'm going to request Dr. Hari Prasad to please do that. But I want to start off by asking two questions before I hand over to him. The first person sitting in the audience is someone who has steered Indian healthcare in many, many ways. He was also the chairman of NABH. So Dr. Narottam Puri, maybe please give you the mic and request you to give a comment and also ask any question that you would like of this wonderful panel.
Thank you, Sangeeta, and good morning, everyone. It's indeed a great pleasure being at the Patient Safety Conference. Yes, I plead guilty to having been involved right from the day the NABH charter was being planned, and the first hospital actually got accredited. It was the President of India, Dr. Abdul Kalam, who actually gave away the first 5 hospitals that got the NABH accreditation. From the perspective of the three-legged stool that Paula referred to, I'd just like to say healthcare is also the 3 A's. The first is access, the second is affordability, and the third is assurance. And it is assurance that patient safety, the patient really looks for. And yet it's number 3, because without having accessibility, without having the affordability, you can't really reach the third. I must compliment Dr. Indu Bhushan, whom I've interacted with both in the Ministry of Health and in his now much better looking office at Connaught Place, with the look of he's far better qualified than many of us who are talking about it, as you would have seen in his CV. And I must compliment you, sir, for the simple reason that the simple vision of being able to provide a universal health coverage has been the dream of many of us, but that within our lifetime we are going to see the fruition of it will probably rest on your shoulders. All that we can say is that whilst you're looking at this 500 million people, India is a nation of 1.3 billion. Let's not ignore the other who may not be part of it. And as the private health sector provides the bulk of that care, we must now move towards this situation where this distinction between public and private must start merging. And we need to provide far greater access and affordability. To that extent, I'd like to compliment both Niti Aayog and you that those which are accredited hospitals are being given greater financial liberty. You are being given more money for providing the same service. And this actually IRDA has also done. Sangeeta Reddy herself is very much involved with what we have done. And just for your information, the standard treatment guidelines were first created by the healthcare industry through FICCI at the request of IRDA. And they were adopted by Madam Sujata Rao, who was then the Secretary of Health. So the SDGs actually exist. So my request and humble suggestion would be that let's not reinvent the wheel. Certain SDGs exist, certain plans exist, and the merger of quality with access is actually very, very important. And both of them combined can give affordability a chance. And I think when we are talking of, since I represent now the private healthcare industry, having been in the public healthcare a long time ago, I just request that private healthcare's role should not be undermined. I think what is happening is nobody is questioning the ability of providing volume service at lower costs. But let's not forget that ultimately high cost costs less, high quality costs less. And if we are talking of patient safety, yesterday in the CEO's forum I was mentioning the same thing. In the year 2017, 4.6 billion people took a flight in 4.1 million aircraft. There wasn't a single fatality. In the year 2008 to 2017, in the United States, no one lost life in an aircraft accident. And yet 1,000 people died because of one reason or the other in the same American hospitals. We probably don't have that data. And you are sitting, or you're going to be sitting, on a plethora of data. My humble request would be that you please do a better data mining that we have done henceforth. Because what is past, but the future, this data will become very, very useful for us. Thank you very much.
Thank you, Dr. Nayak. Does anybody want to respond to this? Dr. Indubhushan, do you want to respond to what Dr. Nayak said?
Thank you very much, Dr. Puri. I take note of the fact that, of course, and acknowledge again, I've done that before, the critical role of private sector in making our scheme a success. And you are absolutely right that although for last 70 years we have been investing very heavily in public sector, but still 70% of healthcare is provided by private sector. And I think even at the tertiary level, this proportion is even higher, and for time to come, it will still be the case. And when I look at our scheme, where we are expecting that in a couple of years' time, we'll have at least 10 million more new admissions. And if you're talking about 10 million more new admissions, they can't, of course, be serviced by public sector. Good public sector hospitals are already stretched to their limit, and we are looking at improving in efficiency both in public and private sector to cater to these additional 10 million treatments, but also expansion of capacity in private sector, and that of course takes time, but hopefully it will come soon. So I'm very supportive of what you said about the role of private sector, and we also have the same philosophy that we need to work with private sector. Now on SDGs, I fully agree with you that a lot of work has been done, and indeed if we don't rely on this work and start from scratch, probably it will take several years. So obviously we are relying on body of work which is already available in the ministry, and also with the Department of Health Research. They are collating it for us, and hopefully we will have STGs, or what they call standard treatment workflows for most of our 1393 packages that we have. And I also fully agree with your suggestions about data analysis to look at how to improve patient safety, reduce reinfections, and improve quality of services. And hopefully the data that we are collecting will help in doing that, and I'll be seeking partnership with the outside institutions to help us analyze that data in that direction.
Thank you. With such a distinguished panel on the dais, I'm tempted to ask this question. The Universal Health Program is a humongous program and probably the largest in the world. And when we've seen similar programs being implemented in some of the other countries, with much at a smaller magnitude, they ended up incentivizing poor quality care. We can't afford that, to allow that to happen in this country. What are we going to do to, or what should we do to allow to make sure that this scheme actually incentivizes good quality care, and all four on the dais can respond to this?
Well, since you're asking this question, I have a feeling that you also probably have some of the answers. And so I'm going to be seeking your help in those answers, but I can also share with you what we are doing to incentivize quality. One, and I'm sitting with you, so we incentivize certification by NABH. So if a hospital is certified at entry level, we give them 10% extra money, and if they are being incentivized certified fully, then they get 15% more. So that itself is an incentive. But 15, yeah. But more than that, I go back to what Dr. Puri was saying earlier, that if we have the definition of quality, because how do we define quality? And so we have SDGs which we define that for every health condition, procedure, we have defined the process, and we can ensure a system to come for compliance, that there's a